Hello, my name is Kathleen Lesson. I'm a certified lymphedema therapist and board certified massage therapist. We're here at my new studio in San Diego, and this is my giant chart. So this chart should be very helpful for you if you are a lymphatic massage therapist and you help people after plastic surgery, and you kind of want to get an idea of how I think, why I will use specific modalities at specific times in healing for specific operations for clients that have these operations. So I'll go through this and explain it in this video. What I won't do is give you just this sheet of paper that you can copy and then look at later. And I'm going to tell you why I'm not going to do that, because what I have seen in my career is every single modality we use, there's a different way that we use it for people after plastic surgery that is different than when we would use it for a healthy client who did not have surgery. So I just gave you this. You would read it, someone might read it, and they might say, oh, hot stones right after plastic surgery. That must mean the same type of hot stones that I was taught in massage school, where you get the really hot stone and you put it right on the client's skin. And that is contraindicated strongly for me after plastic surgery because the stone is too hot. And for two reasons: you should not ever park a stone on somebody's body, especially after plastic surgery, because they may be on some pain medication, so they couldn't communicate to you that the stone was too hot for their skin. And then also the skin is very sensitive after the plastic surgery, and they may not actually have the amount of healing that would allow them to have proper normal skin sensation. So they might not even feel it because they're numb, and they might not even feel it because they're on pain medication. So this is why you have to take extra precautions and do things differently than how you learned in massage school if you're helping someone with the same modalities that you learned in massage school, but your client is coming to you right after plastic surgery. So let's look at the chart in the beginning. So I picked 4 operations that I see clients after. Liposuction, Brazilian butt lift, which involves caring for the liposuction and also not touching the fat transfer on the Brazilian butt lift. Abdominoplasty, tummy tucks, I see a lot of clients with those, and facelift. And then over on the top of the screen, you'll see I start roughly from 0 to 2 weeks, 2 weeks to 1 month. And then they're usually in the proliferative phase over 1 month and then over 3 months. So let's look at each of the sections in detail. So the first for liposuction, and then we'll go all the way over. So in the first 0 to 2 weeks, if I'm seeing someone 4 to 5 days after their liposuction appointment, their incision should be closed. They should have bandages over their incision. There should not be any blood leaking out, any tumescent fluid leaking out onto my table. And what am I doing? MLD, manual lymphatic drainage. So this is a gentle skin stretching stroke. So it's not light as a feather. You were actually getting a good skin stretch. I'm not using any lotion for this because I want indeed the skin stretch with the MLD. I'm also doing lymphatic cupping. So this has nothing as far as the pressure you would see in traditional Chinese cupping. Lymphatic cupping pressure is much, much lighter, and you can see the demonstration videos of my lymphatic cupping in my lymphatic and fibrosis cupping class. So I'll use lymphatic cupping on them. I find that it is very useful to get that skin stretch, to get the same intention as what I'm doing when I do the manual lymphatic drainage, to help them put the swelling into the lymphatic system so they urinate it out. With lymphatic cupping, if when I try to do my MLD stroke, because of the sensitivity of their skin, particularly in the first week after their liposuction, they may not be able to stand regular MLD. And when I say stand regular MLD, I have a pain scale, in my office right next to my table, and I say if the pain is over 4, if it's over 5, it's too much and we're doing something different. We're going to get clever, get the same results, but do something more gentle so your body doesn't feel that intense level of pain. And I've really found the lymphatic cupping, if their pain is at a 4 or a 5 with MLD, once I stop MLD and use lymphatic cupping, their pain is at a 0 or a 1, and they're able to relax during the rest of their massage, which is so important for clients after plastic surgery. And then I'll also use hot stones, but like I said before, I'm not taking the hot stone and placing it hot stone out of the heater directly onto the body. I'm taking the hot stone out of the heater, placing it into my hand, and then getting oil, and then using that warmed hand while the stone is in the other hand and doing the massage, and then switching off. So they get the sensation of a warmed oil, and my hands are warmer than usual. I have, because all of us had to get one of those forehead thermometers, and I've actually taken a skin temperature reading after I did this type of moving hot stone massage, and the temperature increase on the skin was not high enough that I would be worried that perhaps the lymphatic system was not working properly anymore. The other benefit is that the client gets to really relax, and if I'm doing any other type of massage and before, after I'm using the hot stones, that massage I feel like I can go deeper with a less level of pain verbalized to me from the client. So that's why I really like the hot stones. And the hot stones really have to be a lot closer to room temperature before I will actually put them on the client's body. The stone is always moving when it's on the client's body, and I never park the stone or leave it on an area of the client's body at any time after surgery. And the other thing is stretching. So I'll have the clients put their hands behind their head like this, and they'll get a gentle stretch of the torso. And you can learn more about why I do the stretching in that lymphatic cupping class to learn about some of the research behind the link between stretching and reduction of inflammation after a trauma. Very exciting information. So glad to be able to find it and put it into my lymphatic cupping class. At 2 weeks to 1 month, I'm doing the MLD, I'm still doing the lymphatic cupping, I'm still doing the hot stones. I might add vibration massage, and I love adding vibration when people have edema. From whole body vibration to a stick that carries vibration to it, to I even have a circle tool that has vibration in it. I think I'm going to have to in the future make a vibration class so I can give you details of how powerful vibration is in reducing edema in the body. And I'll also do myofascial massage, and this will be gentle. Again, we're always looking to the hot stones to make the massage a little more pleasurable and less painful, and to always have that pain scale so we know that the client is having a comfortable massage. And I do have a myofascial massage class where I show you the strokes I use on my clients after liposuction, and it's usually very pleasurable. The clients really like it, and they feel less of that tight bound down feeling after the massage. They'll feel a lot looser after the massage. Stretching, just the same as I explained before. And then lymphatic focused kinesiotaping. So you can get, there's several classes out there that will show you different ways to use kinesiotape to affect edema in the body. So that's also a tool that I would place at this part. So over 1 month, we're doing everything that we did before, MLD and lymphatic cupping. I'm doing hot stones. I'm starting into the fibrosis massage cupping. If I see fibrosis, I'm using fibrosis massage cupping to help that. And that is, again, something you can learn in the cupping class that I have. And then I use IASTM tools. I talk about IASTM tools a little bit in the plastic surgery recovery and fibrosis massage class. I will also direct my students that you need to get a proper hands-on in-person education in IASTM, so you know how to use the tools before you start taking that information that you know and trying to apply it to post-surgical clients. It's definitely not something you can just watch a few YouTube videos on, because there are so many incorrect YouTube videos out there about IASTM, and just try to help people after surgery with it. Definitely worth investing the money to get the class, and the classes will often have CEU units on them. And then vibration massage I spoke to before with the edema. If it's just liposuction, they didn't have any fat transfer, I have a whole body vibration machine that they can stand on. Again, the myofascial massage, the kinesio taping, and then targeted exercise. At this point, over 1 month, they should be able by their surgeon to return to exercise, and then there are exercises that will help them both tone up and reduce inflammation, reduce edema in the body. And a lot of these I learned in the class as a certified lymphedema therapist. You can definitely see exercises for lymphedema videos on YouTube that will show the joint movements and the joint range of motion exercises that will really help to reduce edema. And then finally, over 3 months, they're pretty much cleared for anything. They can have body contouring, they can have Swedish massage, they can have petrissage, they can have sports massage and more sports taping, they can have regular massage cupping, they can usually return back to full exercise, and they can use vibration tools however they want. So that's basically my recipe for liposuction. Brazilian butt lift is a little bit different. So Brazilian butt lift, I will still from 0 to 2 weeks. I'll do the MLD, I'll do the lymphatic cupping, I'll do the hot stones, I'll do the stretching. I won't do any of these on the fat transfer area, whether it's to the breast, to the butt. It's kind of, the theory is the same, wherever you have a fat transfer, you don't touch it for the first 3 weeks to a month at least. And then it depends on what the client wants to do after that. So I will do all these things for the BBL, and then I'll do bolstering. And I show the video on how I bolster clients for after their Brazilian butt lift in the plastic surgery, recovery, and fibrosis massage class. You can see exactly how I bolster people for the Brazilian butt lift, so they can lie on their back, so they can be fully covered by the sheets, and we can help them with the massage while they're prone and supine and fully covered at all times with the sheets. And again, no massage on the fat transfer. So 2 weeks to 1 month for the Brazilian butt lift, I could still do all these things. I also keep on bolstering them. No massage on the fat transfer. And I will say, if you're doing vibration massage, no vibration massage on the fat transfer. So that's important to know. If you have a whole body vibration machine, don't let them stand on it because they're vibrating their fat transfer. So no vibration on the fat transfer. I can use a local vibration, like a tool that I'm using on another area of their body away from the fat transfer. Great, but just no vibration on the fat transfer. And then over 1 month, everything that you can do for the liposuction, again, no massage on the fat transfer, no vibration on the fat transfer, and no whole body vibration. And then after 3 months, really I ask them, are you sitting on your butt? Are you sleeping on your back? And if they're doing that, everything from liposuction is pretty much open to them. So that's what I will do for liposuction and Brazilian butt lift. So let's talk about abdominoplasty, the tummy tuck. So I will do, in the first 2 weeks after a tummy tuck, MLD. I will do hot stones, and I'll do stretching. What I'm not going to do is stretching on the anterior body, so having them straighten up. They can do like a lateral stretch, like this right here is lateral stretching. It's not anterior stretching. And I will not do lymphatic cupping. I won't do any cupping over the surgical area because we're worried about a shearing force, and we don't want a shearing force over the area that was operated on for the abdominoplasty. So I'll say the bolstering, you can definitely bolster them so they're in a jackknife position, so they're not lying flat on their back. and no anterior body stretching, no lymphatic cupping on the abdomen. At the 2 weeks to 1 month mark, I'm doing MLD. I'm not doing lymphatic cupping. I'm doing some hot stones. I would do the vibration massager on another area, not on the area that they had their tummy tuck. I do definitely the myofascial massage for the back, for the flanks is amazing, especially the back and the neck. That's when you're going to start to get clients that are very sore because they have to sleep in a recliner, they have to sleep in a different position after their tummy tuck. I'll do the lateral stretching, and I'll do kinesiotaping if it's not in the surgical area. So no anterior body stretching, no myofascial massage over the front. Again, we're worried about that shearing force that we don't want. No vibration on the abdomen, no lymphatic cupping on the abdomen. And then after 1 month, I don't actually add any new modalities for the tummy tuck. I'm just sticking with what we know works, the MLD, the hot stones, and you could do on the flanks, on the sides, if they did not have a whole body lift or an extended tummy tuck. If they just had maybe some liposuction on the sides, you can do the myofascial, you can do the stretching on the flanks. And then at 6 weeks, you can start doing scar massage, just gentle scar massage techniques that you already know. Ideally, if you learn them in conjunction with your oncology massage class, they would work great here after 6 weeks once the surgeon has said it's all right to do the scar massage. And then over 3 months, I really want them released from their surgeon, that everything should be okay. Again, we're worried about the shearing force over the surgical area, and I want the surgeon to tell them when they can return to exercise and when they can get just a regular deep massage. It's not our call, it's the surgeon's call. And then lastly, let's look at facelift. I love facelifts. It's one of the most rewarding type of massages I do. I'm going in for a facelift later this year, so I'm really excited that I can apply some of the things that I tell my clients to do after their facelift for my own recovery. So, and I do have a facelift class where I teach other therapists how to help people after a facelift. So 0 to 2 weeks, MLD, and we're doing it with bolstering. So we're raising up that head. They should have their head raised up, head and shoulders about 35 degrees. When they're sleeping, the head should be raised over the heart at all times after the facelift. So I'm doing MLD. I'm also doing posterior neck massage, and that will really help the clients because the stiff neck is a big part of the facelift, not only because of the surgery, but because of how they have to recover, how they have to lie in the bed at an elevated angle. 2 weeks to 1 month after a facelift, we're doing manual lymphatic drainage and bolstering. We're doing posterior neck massage, and then I might get into the scalp for a nice scalp massage. This usually at 2 weeks to a month. If they have staples, if they had like a coronal suture or any advanced extra type of surgery accompanying the facelift, those staples should be out, and we can give them just a gentle scalp massage. And then I'll also do facial massage. I'll do cupping, and you can see the video of my facial cupping. And I'll also do cupping to the neck. And the neck massage, the MLD on the face and the neck is so important, especially if they had a neck lift. They'll come in saying, I feel like I'm being choked. It feels so tight here. And 1 to 2 sessions of MLD can really make a difference for them. That's why I love the facelift post-op recovery so much. So after a facelift, after a month, we're just still doing the MLD. We're still doing the bolstering. The MLD is different. It's a little bit different than doing MLD on someone with normal lymph nodes because of the cut in the surgery right here. That's what causes the swelling because the lymphatic system, the lymph vessels have been cut that are going to this lymph node, so we need to reroute the fluid, and I show you how to where and how to reroute the fluid. There's actually interesting literature on that. doctors have done research on where the lymph nodes are actually, where the lymphatic fluid is going and which lymph nodes it's going to after the surgery. So I'll still do the MLD, I'll still do the bolstering, the posterior neck massage on the scalp, and I'll do face and neck massage cupping. So not a lot different from 2 weeks to over a month. And then I just have them, if it's over 3 months, between a month and 3 months, I just have them specifically get a release from their surgeon before they go ahead and do like a regular facial from their regular esthetician. But that is what I do for the facelift. So that we've kind of covered right now all my ideas. And so this is how I put together my sessions in my head. I see what kind of surgery they have, and I see where we are out from the surgery, and I feel to see if they have fibrosis or not, to start the fibrosis massage cupping. So this is kind of the chart. This is like the inside of my head. And I hope I've done a pretty good job of explaining how I adjust each of the things that we learned in lymphedema therapy school, in MLD classes, in our regular massage classes, in our cupping classes, in the hot stone classes, to kind of help clients safely and gently after plastic surgery.